this is why, with all the respect, this Medicare for all or all equal or whatever, it just isn't going to work.
Yeah.
Okay. And this is kind of ties into our main topic, obesity.
How is that?
Well, healthcare cost,
Yeah.
right? I mean, if you take Black Americans, 1 out of 2 Black Americans are overweight, obese, followed by less fraction of Hispanics and whatnot than whites and Asians. But we're talking about 40% of Americans are overweight / obese,
Yep.
which means BMI of 30 and up.
Yep.
I think the classification under severe obesity, where BMI I think is 40 and up, is almost 10%.
Yep.
Healthcare costs.
You're 100% right. It all adds up.
And what I want to do in my own setting, this is one of the things I want to do, is I really want to tell patients, and I do. I had one patient recently who really listened to me, but I told her she needed her help to get pregnant. I said, I don't want to help you. She said, like, why? Because you're not healthy. What do you mean I'm not healthy? I'm on no medication. Well, because you are riding on your youth, right? If you're young, 20s, your youth, you're fine.
Mm-hmm.
You may not need any medication. But I have to convince people that there's nothing good about pregnancy except for the end result. Pregnancy, there's nothing good about the pregnancy. It major toll on your body. You're never the same. So obesity is such a problem that I wish I could convince people to, let's fine tune you over 3 months, 6 months. Let's make sure that you're not at risk for developing diabetes, gestational diabetes, which, by the way, 90% of American women are at risk for because of one risk factor or another. BMI over 30 alone is a risk factor. Age over 35, pre-existing medical condition. So 90% of American women are at risk for developing gestational diabetes. So what happens when they develop gestational diabetes? Well, it's inconvenient because they need to be monitored closely. Some of them need medication, and some of them need fetal testing, and they may need to be induced, which may increase the risk of C-section. And then they come to you, and well, instead of being delivered at term, maybe they're delivered at 36 weeks. Now you're dealing with preemie. So simple pregnancy now becomes, instead of $20,000, $30,000 vaginal delivery, it's C-section. Now it's $40,000 to $50,000. Babies in the special care, that's $100,000 per week. So now you add all that up, $500,000.
Yeah, and there's risk to the baby too, the fetus. So
growth, because then they're at risk for developmental delays and intervention they require, whatnot. So the kid isn't going to go to Harvard or BU. I don't know. So this whole it's all related. Obesity is such a significant problem, and I really want to, tell my patient it's an issue. But what happens, at least in my practice, many of them already have that issue. Yep. They come, and luckily they are very receptive to my suggestions. But it's a tough problem. Yeah. I mean, at Winchester Hospital, right? If your BMI is over 45,
you can't get in the door.
You need anesthesia consultation.
Wow.
If your BMI is over 50, then you cannot deliver at Winchester Hospital. And you say, like, well, must be like 1 a year. No, there are more than a few whose BMI is over 50, so they cannot deliver at Winchester Hospital. So now they have to go bypass Winchester. They got to go Longwood Avenue, beat the traffic, which I'm sure will do a number on that blood pressure. And because she probably has medical condition which developed during pregnancy, which means she probably has to go twice a week. I mean, where does this end? And we talked about beginning of this conversation where obesity, it's a problem, but how do we address it? It's not simple. I mean, here I am, I'm a physician, and I don't know what my BMI was. I don't even want to calculate it, but it took a personal life event to really figure out what to do. And I'm a guy. For women, it's very complicated. So you know what I tell my patients? I'm talking, you're listening, you're yawning. Go ahead before I kick you on your shin from underneath the table.
Long day.
The problem with women of reproductive age group in America right now, they're not like their mother's generation, because women are expected to look good, right? And they have to live in the right neighborhood. They have to drive the right car. All this social media, like we're doing right now, there's an expectation. And I think it's really hard, right?
It's hard. No, I'm just thinking about your point with all the medical issues and the healthcare dollars, and if
Did you vote for Sanders? Is that why?
No, me.
Oh, I forgot. He's not from Maine. He's from Vermont.
I think my ballot got lost somewhere. I'm not sure.
Yeah.
I miscounted.
Right next to mine.
Yeah, I actually wrote an Oprah. But if the insurance companies, going back to that, really cared and really put the money where their mouth was, I think they could make a little bit of a dent in this better. And there's been patches put on this obesity epidemic. It's not a pandemic, it's an epidemic. And it's just not getting fixed. And, we talked a little bit before how this body mass index, this calculation that we do to calculate how heavy you are for how tall you are, right? And then it depends on how old you are. If it's over a certain amount and you're characterized as obese, overweight, you don't use the word fat anymore, right? Big boned, is what your health risks are. And like 10, 15 years back, it was like the big buzzword, and people were all hopping on the bandwagon. And everybody's trying to, to fix this medical condition, because it's a medical condition, really. But I don't know if we're any better now than we were then.
We're not.
Maybe the insurance company should be giving every household with this $19,000 an hour salary, every household a treadmill, or an elliptical, to use.
I think it starts way before that. It's
true with eating and nutrition and
exactly.
Yeah,
because our parents didn't know any better.
Yeah, but how we got to fix? Yeah, there's prevention and there's fixing the problem. And how we fix the problem. It's a mess. And I've said before is that having this BMI gave us the ability, as in the limelight, this ability to talk about this more. And because it was almost like a little taboo. Like, parents would come into my office and say, beforehand, don't mention anything about the weight. It stresses him or her out. And
well, that's a good point. Now, I talked about my patients in your practice, pediatric practice.
Yeah,
it's a big problem, right? You see kids.
Yeah.
But are the kids who are overweight or obese, are their parents usually obese and overweight? In most cases, is there?
I gotta say, in my practice, first of all, we have a pretty good rate of not being obese.
Is that because of you're in an affluent area?
I think that's one of the reasons. But we definitely have our kids who are overweight, and you name any medical, physical, emotional problem, we got it. Even in this area that we live in, so you name it, I've seen it probably, and there's no boundaries to anything. But yeah, I'd say that it's a mix. There's a mix. Definitely, the overweight parents often have overweight kids, 100%. But we have, kids who are overweight and the parents aren't. But we talk about it, and it's important. And we're trying to like I always tell kids, I don't really care. I ask you, do you play sports? Do you play musical instruments? Do you whatever? Do you sing? Do you do art? I don't care if someone's on a sports team. I just want them to be active. I don't care what that activity is. I don't. We talk about healthy eating. It's all about laying down the groundwork now for the future, so they don't turn into overweight adults, right? So they enjoy going for a walk or going for a hike or playing tennis. They're not going to be in some baseball team when they're 50 years old. They may be, but we want them to enjoy being active and fit. And we know that if they can lay down that groundwork early and have good habits and practices. And obviously you did something in the past that allowed you to do what you need to do in the future. And we have to talk about this. And if we did a better job, I suppose, right? The pediatricians, you wouldn't be seeing this as much. It kind of falls, I think people really forget how much falls on us. There's a lot of responsibility, as I think about it, on pediatric primary care to set things for the future.
It's like if a kid is messed up, we blame parents. And if kids messed up,
blame Dave Geller.
Dave Geller, pediatricians. You guys didn't, do your stuff.
And if the patient's got chlamydia or gonorrhea, I'm calling you.
Yeah.